Robotic surgery is a tool that allows the surgeon to operate through small incisions instead of a large incision. More importantly, it provides a magnified 3D high-definition view of the body. In particular, it allows the surgeon to use small wristed instruments that have more flexibility than his own wrist. Overall, the robot enhances the surgeon's vision, precision, and improves his dexterity and control. A patient would choose robotic surgeon, or really it's the surgeon who offers that robotic surgery to the patient for several reasons. One, and more acutely, is less pain. Two, studies have shown that we've seen less blood loss. And three, in certain cancer operations, especially in regards to the prostate, multiple studies have shown we've had better cancer control rates. Robotic surgery is really for anyone. However, what we want to look at is people who should not have robotic surgery. The biggest ones are people who already have pre-existing lung diseases or who have heart failure. A lot of times these patients cannot tolerate having their abdomen blown up with CO2. That provides excessive pressure on the heart and the lungs. Also, patients who've had previous operations, radiation, or infection in the site of the operation. That may not be the best operation for them to have as a robotic procedure. Sometimes an open operation is the best operation for that patient. The benefits of robotic surgery are really in the acute setting. We see a lot less blood loss, we see significantly less pain, we see typically shorter hospital stays, and patients are able to get back to their daily lives at a quicker pace. Long term, if you look a month or two out, there's really no difference than open surgery. But in the acute setting, that's where the big difference comes. As with any surgery, there's always risk. Just like open surgery, robotic surgery has a risk of any injury to surrounding organs, most importantly the intestines. Two, with regards to prostate, you could have incontinence, you could have sexual dysfunction, you can have bleeding requiring need for blood transfusion. And then finally, you can have blood clots to the lung that can develop just from not being active. After the operation, I'll see the patient 1 week later to remove their Foley catheter. We also review the pathology, which frankly is the most important thing. From there, we have them see a physical therapist. We have partnered with several physical therapists here in Austin who really are professionals in the pelvic floor and really help our patients get their pelvic floor back into shape and reduces the amount of time that they're having any urinary leakage. At 3 months, we'll check their first blood test, and that's a PSA. We always expect that to be 0, and that is always a big day. Overall, the robot has really revolutionized how we do prostate surgery. It provides the surgeon a greater vision and improves his dexterity to provide a very detailed dissection of the prostate. The studies have shown we do get better cancer control with robotic surgery. From the patient perspective, that patient has significantly less pain, significantly less hospital stay, and is able to return to work, usually at a quicker pace. Most importantly, we need to remember that not all patients are good candidates for robotic surgery. Just because we have a robot doesn't mean we need to use it. It's the patient and the doctor who need to develop a treatment plan to figure out what's the best therapy for them. Sometimes it's the robot, sometimes it's not.